Dr. Dave here with Synergy Wellness in New York City. We have Sylvia here who has been treating for neck pain, numbness shooting down the arm, pain even down into the arm and hand and fingers. She had a horrific skydiving accident several years ago where her shoulder was dislocated mid-air. And if any of you have ever gone skydiving, that's a really scary thought because you have to reach up and grab the rings for the parachute to steer yourself down. Otherwise, when you land, you're going to hit the ground very hard because when you land, you have to pull the rings all the way down. So she couldn't even get her arm up to pull the parachute in the first place, and then second, to be able to control it and have a safe landing. So she had a really rough landing, and we're using a brand new laser here called the Active Pro. It's an MR5 cold laser, deep tissue laser, and we've only had a few treatments with her so far. And how are you doing?
I'm doing great. You're helping me a lot.
How's the arm pain right now, the numbness in the arm and hand?
The numbness in the arm is stopped on the second day.
Second day, okay.
Yes.
So we're doing a mixture of chiropractic with her, but also this laser. This laser is an incredible tool. It helps to heal and repair soft tissue at a much faster rate. That's why all the professional sports teams are using it. I even used it in 2012 to rehab my Achilles, my torn Achilles. So we're gonna do some laser treatment here, and we're going to do mostly this side of her neck and spots in the arm and show you how this works. This laser is really nice because it has an impedance meter. So it actually tells me what's going on underneath the skin, and it'll beep and let me know if there's inflammation under this spot as I scan, or if there's a muscle spasm or a knot, tight muscle. It will find it. And oftentimes I can find them on my own, but as we run this all the way down the shoulder, and there you go, it found a spot right over her AC joint. And with this laser, we're able to treat people faster. We have a few other lasers here in the office. This is our newest laser. Deep tissue laser, again, is really good for healing soft tissue damage, any partial tears, tendinitis, carpal tunnel syndrome. We even use it for people with disc herniations and spinal stenosis because there's always soft tissue damage around the joints when you're dealing with chronic problems like that. Also range of motion, increases range of motion, torn meniscus in the knees, and again, any type of soft tissue injury or damage. We're going to just run it all the way along the trapezius muscle and in the back of the neck. I'm going to have her bend your head down a little bit. So by doing this, we open up the facet joints where most of the nerve endings are in the facet joints in the neck and the whole spine, and also around the disc. So we're getting those areas by opening up the back of the space here. And the beauty of this machine here, it'll even tell me exactly how long I need to dose the area, the spot. Is that a tender spot in your neck right there?
Yes.
It's amazing how it finds the exact spot. Really incredible. No, you don't feel a thing. You might feel a little bit of warmth, but that's just because the stim is on, the impedance meter is on. But when the impedance meter is off, you don't feel anything. You just feel this running across your skin. It's very safe and extremely effective. And then we're going to go up along the supraspinatus muscle because Sylvia is a chef. And she's working with her hands and arms all day long and needs them to function properly so she can continue to pay the bills and work and live life, okay? So right here, it found a spot right over the brachial plexus. This plexus of nerves that exits from this area runs down the arm, controls sensation in the arm, and also the muscles in the arms and hands and fingers. And you're tender in that spot too, right? Right over the belly of the supraspinatus. So again, this takes about 5 minutes, and then we're going to do a few other spots in her arm. And if you have any questions or comments, feel free to comment.